In this video, I am discussing again a recall communications. That I speak to a mother of about 7-year-old child with nocturnal enuresis. So the child is 7 years. Remember, nocturnal enuresis or bed waiting. So as usual, we are starting IRCP. Introduce myself, making a report, taking the consent and agenda, then attendance, also prior knowledge. So he's having bed waiting issue. He driving me crazy. You have no idea, doctor. He's wearing himself. He's waiting himself in every day, and I'm changing his sheet once or twice a night. It might be something ori with him, and why he has this bed waiting, doctor? Then we are telling the answer like, I understand your feelings. I know it is must be difficult for you. Hopefully, after this meeting, we will make everything easier. So, for your questions, why my child had bed waiting? Some children are deep sleepers. They cannot wake easily from bed to go to the toilet. Some children had small PBAC. Some children also may had constipations. Also, sometimes it runs in families. May also due to stress in the school or home. I am making myself clear. So first, mother is asking that why that is happened. The cause we can tell like that someone has small PBAC, some has constipation, some has family running in the gene, some has deep sleeper. These are the cause. Now am I making some clear? So the mother is asking, what will I do? I gonna do. First of all, we have to add some changes of the lifestyle. So lifestyle modification, we call it lifestyle modifications. He had to limit his fluid intake before bed. In the daytime, as much as he want, but he should take his fluid needs maximum by mid-evening. After that, the time he should drink any more water, and if he go thirsty, he should drink small sips of water. Are you with me? So the management purpose, first we are going for the lifestyle modification. That is, he can take at the daytime as much as his fluid, but at the mid evening he will start fluid restrictions, like he thirsty sips of water. Okay. Also, he should avoid any caffeine containing fluids and food like Pepsi, coffee, and chocolate. So Pepsi, coffee, chocolate, caffeine containing food should be avoided. Doctor, as it will irritate his PBAC. These are caffeine causes irritate the PBACs. Now, what else, doctor? What is the next step of management? Is that during the day we will encourage him to hold his pee as much as possible, as this increase the capacity of the pee bag. Also, we have to ask him to pee before he goes to the bed, and make sure the way from bedroom to the toilet is lightened, so not got scared. Use waterproof bed linen. Avoid punishment, as this will make things worse. Keep this in secret. Am I making myself clear? So next step is that first of all we will encourage him to hold his pee as much as possible. That will increase the capacity of his, number one. Number two, ensure that is from his room to toilet well lightened. He can't scare to go to the toilet, and we will not give him punishment. We will give him reward. If we give him punishment, that worsen the condition. Also, we don't say anyone this. So any other options? Yes, some other management is that. The second option is star chart. We have to do lifestyle modification side by side to the star chart. We'll hang a chart and you will give a sticker or smiling face. He got a sticker for good behavior meant by follow the lifestyle modifications. We are rewarding the good behavior, not dry night. For dry night. So we are giving star chart. We give him smiley face because of his good behavior. What will we do if he got wet his bed? So already wet his bed, that will involve him in changing his sheet. This is not a punishment, but that take the responsibility for his action. So he will involve him to change his bed sheet if he wet, because he will take the responsibility. It is not a punishment. What will do if lifestyle start chart cannot work? So lifestyle and star chart is cannot work at this time, may need to use the bedwetting alarm. It is a special probe attached to the child underwear. It gives alarm when the child starts to pee fast, drops, and wake him to go to the toilet for finish his pee. But it is effective only after 7 years and after using it for 4 weeks. If dry, for 14 consecutive days, complete for 1 month. If partial response, use it for 3 months. If not dry nights, not try again. So he is 7 years age old. Then we can use the special bedwetting alarm. That is a special probe attached to his underwear, and it gives alarm for fast few drops and wake him to go to the toilet and finish his pee. But it is only effective only after 7 years of age and using it for 4 weeks. If dry for 4 consecutive days, so 4 weeks he will use this alarm which is attached to his underwear. If 14 days it works, then we can go. If it's not working after 3 months, then we'll stop using that. I think we need to do some tests. So we have already done a P test and it is completely normal, but We have to be attention if any burning pee, any change of urine color in the morning, he is going to toilet a lot or he cannot wait his turn in toilet. At this time, you should seek medical advice immediately. So if any task for bedwetting they are asking, no need of task, but some when some red flag or warnings and we tell that like changing the urine color, burning pee, frequency is increased, he can't hold this pee. So then we can seek medical advice. So all communication we need to keep our mind. Some red flags will tell. So I did not hear you're saying any medication. So there is a medications, but it can be used after age of 7 years and is a special situation like sleep over a party or going a camp. So that is a special situation we can use it medication 7 years. Why not use it now? Because it can cause water accumulation and salt disturbance in the body. Causes water accumulation, salt disturbance in the body, the side effects. Now trusted website, written leaflets and support groups. So our child is 7 year old. What is the medication? That is desmopressin. Remember, desmopressin we are using for bedwetting. It works by reducing amount of pee. How it works for 7 years old child? It is useful for a short spell of time, like the child is going to trip, then it is used. If need to be tried or 1 week to see efficacy and proper dose. So if first time and trip is about less than 1 week, we can try the solution as contact with the school teacher to correct children with same conditions. Use this waterproof bed sheets or use diapers. Medicine present in two forms, swallow tablets or melted tablets, no nasal in bedwetting. Medicine put under tongue is to dissolve and go straight into the blood stream. This is preferred as not affected by food. Okay, usually taken at the bedtime. Child should only have small sips of fluid 1 hour before the medicine and do not drink anymore at morning. Used for 4 weeks and stop a week to assist. If good response, then continue for total 3 months. If partial response, continue for total 6 months. If no response, then stop. Drawbacks is headache, feeling sick and confused, mild tummy pain, much serious is too much fluid in the body lead to serious problems, salt disturbance occur. So desmopressin is the medication which is after 7 years we can use. It is a short term period, like going a trips or going a picnic. So he will take it like swallow tablet or melted tablets. And just a sips of water she take and she drink this. If good response, then continue for total 3 months. If partial, continue for total 6 months. If no response, stop. And use for 4 weeks and stop a week to assess that it can do improving or not. Some drawbacks we should need to keep in mind like headache, confusions, mild tummy pain, serious is fluid accumulate in the body and salt disturbance. So if fluid accumulate and salt disturbance, then we need to seek medical advice. So this is all about bedwetting, nocturnal enuresis. 7 year old, remember, we can use this medicine desmopressin. Okay, thank you.